I'm delighted that this chair is taking place because of the importance not just of health for education, but of education for health. I began my book, The Health Gap, with the question, what good does it do to treat people and send them back to the conditions that made them sick? Universal health coverage, of course, is vital, but we need to address the conditions that make people sick, the social determinants of health. And I brought together much of what I think we know on this, firstly in the WHO Commission on Social Determinants of Health, then in my review of health inequalities in England, the so-called Marmot review, and then for the European region of WHO, we did the European review of social determinants in the health divide. 2 weeks ago, I was in Washington, D.C. to present the summary findings of the PAHO Commission of Equity and Health Inequality in the Americas, Just Societies, Health Equity and Dignified Lives. And education plays a vital role. I'm going to show you some data. This looks at life expectancy at age 25 for men in 15 European countries. ISCED, the International Social Classification of Education, 0 to 2 is primary education, 5 to 6 is tertiary education. Look at Sweden, SE. Sweden has the longest life expectancy at 25 of these 15 countries, and a narrow gap by education. Now look at the former communist countries of Central and Eastern Europe, Estonia, Hungary, Romania, Bulgaria, Poland, lower average life expectancy, and a huge difference between those with primary education and those with tertiary education. There will always be social inequalities in complex societies, and those social inequalities will translate into health inequalities, but the magnitude varies enormously. And the disadvantage of having low education is much bigger in countries of the East in Europe. In fact, when you look at the between-country differences, they're much smaller for people with university education than they are for people with primary education. They do know how to get good health in Estonia and Romania and Hungary and Bulgaria and Poland because they achieve it for people with university education. And I think there are two components of education that are key. One is that it buys you better circumstances in life. The disadvantage of having low education in Norway is much smaller than the disadvantage of having low education in Romania, because you have subsidized childcare, you have healthcare free at the point of use, you have good quality schools, good social services, subsidized transport, and the like. But the second thing that education does is it educates people with life skills, always and everywhere. That's going to be an advantage. You know that there are all sorts of advantages to education. This is fertility rate, births per woman, according to Mother's Education. Bangladesh, women with secondary or higher education, 2.5 births per family. 2.1 in India, 2 in Ethiopia. It's still high in Nigeria. Education is a route not just to survival of children, but to having fewer children. Domestic violence, a huge public health issue. 35% of women globally suffer from domestic violence. 38% of all murdered women are murdered by a partner. 6% of men. And look in country after country at the percent of ever married women who've ever experienced spousal violence by education. The more education, the less likely are women to be beaten up by their husbands in country after country. In my English review, I had 6 domains of recommendations, and they're all closely linked, but I want to focus on the first 2 here: early child development and education, lifelong learning. We've been monitoring what's been happening in England on social determinants of health. And one measure that we look at is the percent of children age 5 that have a good level of development, that are ready for school. Social, emotional, cognitive, linguistic, behavioral development. Look at the blue dots. The blue dots are the average for England, average children, and each dot represents a local authority classified by degree of deprivation. So to the right, as you look at it, you have the more affluent areas. And what you can see, the more affluent the area, the higher the proportion of children age 5 that have a good level of development. One way to improve the proportion of the population with good levels of early child development is to reduce poverty and deprivation. Now, look at the red dots. The red dots are children eligible for free school meals. It's a means-tested benefit. These are the poorest children. And when I saw these data, I thought we'd got it wrong. This was exactly the opposite of what I predicted. It's quite good to be wrong. The poor children are doing better in more deprived areas. And I went to East London, a deprived area of London, and said, what are you doing? How come you've changed the gap? You've actually reduced the gap between the poor kids and the rest. And the director of education said, we tell ourselves every day, poverty is not destiny. What we do in our day job is to work with deprived children to reduce the disadvantage of coming from deprived backgrounds. And by golly, they do it. Here's the evidence. They close the gap. In the affluent areas where there aren't so many poor children, they ignore them, and the poor children do very badly. The message here is we can have evidence-based policies, and they work.